Come in.
Hi, my name's Brent. How are you today?
I'm perfect.
Okay. Is it alright if I do a quick head-to-toe assessment on you?
Yep.
Okay. I'm going to start by asking you a few questions.
Okay.
First, what's your name?
Angela.
Okay. And where are you?
My house.
And why are you here?
For a physical assessment.
And what's today's date?
The 17th.
Okay. So by her answering those questions, it shows that her ABCs are intact. It shows that she's alert and oriented ×4 to person, place, time, and situation. Her level of consciousness is she's aware, and she speaks with proper tone and good rate. And now we're going to calculate her BMI. Can you please give me your height and weight?
5'9" and 175.
Okay, so that's a BMI of 26. And now we're going to do the Snellen chart, which tests for cranial nerve number 2. I'd have this 20 feet away, and you would read it. Do you wear glasses or contacts? Okay. So with glasses, your vision should be 20/20. And now we are going to do your vitals. Blood pressure, pulse, and respirations, and temperature. So blood pressure should be 120/80 normally. Pulse, we're going to measure for a full minute. And pulse should be between 60 and 100. And I'm just going to say that it's 60. And your temperature should be around 98.6, and respirations between 12 and 20. Okay. And now I'm going to start with the inspection of the head. I'm going to take a look and see that it's normocephalic. I'm going to feel for any bumps or lesions. Do you feel any pain or anything while that? Nope.
Nope.
Okay. Well, there's no lumps, depressions, or abnormal protrusions. And now I'm going to check for cranial nerve number 7. I'm going to have you smile and frown and lift your eyebrows and close your eyes. Okay, so that shows that cranial nerve number 7 is intact. And now I'm going to feel your temporomandibular joint. Can you open your mouth and move your jaw out? Okay. Is there any pain? Okay. And now I'm going to palpate your sinuses. We're going to go with the maxillary and then the frontal. And I should just feel firm. There should be no protrusions or bumps or anything. Now I'm going to assess your eyes. We're going to check the 6 cardinal positions. If you could just follow this pencil. And now we're going to test for accommodation. I just follow this pencil to your nose. Okay. That's good. And that tests for cranial nerves 3, 4, and 6. And so does the pupillary test. We see that the pupils constrict. Very good. And that is PERLA, which is pupils equal round reactive to light accommodation. Next we are going to take a look at your sclera, which are clear and white, and your conjunctiva, which are pink and moist. And now we are going to check your ears. We're going to take a look at them, see that there's no abnormalities. We're going to feel there's not anything coming out of them. There's no overload of earwax or anything. Is there any pain when I did that? No. Okay. And now we're going to do the whisper test, which tests for cranial nerve number 8. Okay. Go Cubs go.
Go Cubs go.
Okay. So she was able to hear that, and so that shows that it's intact. Now we're going to go to the nose. We're going to take a look, see that it's midline and symmetrical, and I'm going to test for nasal patency. If you could cover one nostril and then sniff, and the other one and sniff. we see that there's no problem with that. And now we're going to take a look at your mouth. So we're going to have you open your mouth and check the mucosa on each side and stick your tongue out. We're going to see that the top is rough and pink and the bottom is pink and shiny. And see the bottom of the mouth. There's no lesions or anything. And if you could stick your tongue out and say ah.
Ah.
Okay, the uvula goes up with the soft palate. And just stick your tongue out now. And that is midline. And that tests the tongue, tests for cranial nerve number 12. And the uvula tests for cranial nerves 9 and 10. And now we're going to inspect your neck, starting with your salivary glands. We're going to start with your parotid, which is up here, and your salivary down here, and then your thyroid, which you're going to feel here. And I don't feel any bumps or swelling associated with that. And now we're going to check your range of motion of your neck. And you would put it your ear to your shoulder, your ear to your shoulder, and your head to each side, and then back and forward. Okay, that's good. Now we're going to palpate your lymph nodes. We're going to start with the pre-auricular, the post-auricular. We're going to go to the occipital, post-cervical, submental, jugulo-digastric. We are going to go to the submandibular, the superficial cervical up here, the deep cervical chain, and then the supraclavicular. Just do that. Yep. We're testing that with the pads of our fingers, and I didn't feel any bumps or anything of that. So now I'm going to feel your carotid pulse on each side. And check each side. And then we're going to listen for brewery, which is a switching sound, with the bell. Breathe in, breathe out, and hold. And same thing with that. Okay, go back to something that I forgot, was to feel the nose for any bumps or anything. There's no pain when I do that. Okay, so now we're going to check cranial nerve number 11. We're going to have you shrug your shoulders with resistance, and there's no problem there. Then we're going to check your upper extremities. We're going to look at the skin color and see that it's appropriate. There's no cyanosis, erythema. I'm going to feel that it's warm. Can you flip it? Feel it's all warm. It's dry. There's no lesions or bruising or anything. I'm going to see your nail, check your cap refill, which is brisk, and check the other side, which is brisk as well, and look at the side for clubbing. Like your profile, there's no clubbing. And now I'm going to feel your radial pulses, which are equal and regular. And we're going to test the range of motion of your hands, shoulders, and elbows. So if you could stand up. If you could stick your arms out and go back, and now go like this and back. We're going to test the strength associated. Push out, push in, and now we're going to do the elbows. If you could go in and out and turn. Yep. And then we're going to test the strength. Can you push? And then can you pull? And then we're going to test the wrist. If you could show off those nails and go up and down and then open and close. And can you squeeze my fingers? Alright, so that's good for the strength. We tested all those. And now we are going to move to the chest. We're going to take a look and see that there's no labored breathing, there's no use of accessory muscles, there's no barrel chestedness or anything of that sort. We are going to, we do the respirations, but we already did that. Now we're going to listen to the lung sounds with the diaphragm, anteriorly and posteriorly. Okay, breathe in and breathe out through your mouth, please. And then we're going to listen bilaterally. Okay, let's see. Tricky. Okay, once again, inside. Okay, and then we're going to listen to the back. There you said. Once again, bilaterally. Tell me if you feel lightheaded or anything. And I'm going to also stay right. I'm going to check lung expansion. If you could just a pinch and then breathe in, breathe out. It should go out. And now I'm going to listen to the side. There is 2 on the right. Jeez. Breathe in, breathe out. And then breathe on the left.
No.
Okay, so those lung sounds are all clear. Bronchial sounds will be up here, and the bronchiovesicular will be more towards the middle, and the vesicular will be in the periphery of the lungs. If you could lay down now, I'm going to assess your neck veins for any distension. This would be done at an angle of 30 to 45 degrees. If you could just turn that way. I'm going to see there's no distension or pulsations. Turn towards me. Same thing with this side, no distension or pulsations. Very high pulse. I can see your pulse. Yeah, but none of the veins, which is what we're assessing for. Okay. So now we're going to listen to your apical pulse. We're going to listen with the diaphragm. Okay, this is midline. Listen for a full minute. Okay. I heard S1 and S2. There was no extra hard sounds like S3, S4, or murmurs. So that's good. And now I'm going to listen with the diaphragm and the bell, the other hard sounds. We're going to start with the aortic up here, pulmonic, the tricuspid, and then the mitral. And then flip it over. Once again, aortic, pulmonic, tricuspid, and mitral. Okay, there's no extra sounds there, so that is good. And now we're going to inspect the abdomen, so if you could lay down. We're going to take a look at the abdomen and look here, see that the umbilicus is midline. Take a look at the side, the contour, see that it's flat, and now we're going to look at the color, feel that it's warm. There's no protrusions or lesions or anything. We're going to listen to the bowel sounds. in all 4 quadrants. And while we're here, we're going to listen to the renal arteries and the aorta with the bell. And the aorta is a little bit above the umbilicus, and the renal arteries are on either side of that. Okay. Sounds good. No brewery, which is a swishing sound again. And now we're going to feel, we're going to feel the stomach with light and then deep palpations with the pads of our fingers. So tell me if you feel any pain. You're just tired.
No pain.
And now we're going to feel deep. So I don't feel anything. Okay. So there's no pain or tenderness, and I didn't feel any masses or anything that I shouldn't have felt. Now we're going to move on to the lower extremities. Take a look, see that the color is normal. By normal, I mean there's no erythema, no pallor. I'm going to feel that it's warm and the skin is dry. I'm going to do the cap refill. And I see that the return is brisk. And now I'm going to do the pedal pulses bilaterally. Feels strong and equal. And I'm going to check for pretibial edema by pushing right here. And there's no edema. The color returns normally. And now I am going to test for the range of motion of the hips and feet and knees. So if you could push your feet out and in, and then together and out. Test the strength, push, pull, and now we're going to test your hips. You go out, out, in, and then bend your knee, go out, and in, and down, and then do the same thing with that one. And then if you could push, if you could pull, you could push, if you could pull. Okay, so the strength is good for the hips and the feet for range of motion and strength. Now we're going to do the knees. Okay, so if you could push and if you could pull, the strength is good. Now let me just see the range of motion. If you could just extend and then go back. Okay, so full range of motion. Now we are going to test for the touch sensation. I have here a cotton swab, and we're going to touch on different parts of the face, arms, hands, legs, and feet. And close your eyes and just tell me where you feel.
Face. Head. Hand. Arm. Arm. Foot. Foot.
Okay, so she's able to recognize where she can feel it, so that's good. And now we're going to do the sharp and dull test. This is a pencil. The sharp end will feel like this, and the dull end will feel like that.
Okay.
I'll try not to push too hard. And we'll do the face.
Sharp.
And the arms.
Sharp. Well, don't tell. You're not supposed to tell me.
Sorry.
Okay.
Okay, so then close your eyes. Your eyes were closed, and you tell me where it is and what it is.
Ow, sharp.
Okay.
Dull.
Dull. Okay, where was that?
On my hand.
And
Dull.
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 And where was
My
that?
forehead.
And where was the other one?
It's on.
Okay. Okay, so you're done with that. And now we're going to do the finger to finger test. So if you could, I'm going to stick my finger out. You already got it on your nose and just bring it back and forth each time. You can go slow if you can't get it.
I'm a
Oh,
master.
you missed. Alright, you're good. And then we're going to check your lower extremities. Can you stand up? Can you put your heel to your shin and rub with the opposite? Yep, you got that. Good. And now, I'm sorry, but I'm going to have you sit down again. And we're going to test your deep tendon reflex.
Oh. Whoopsies.
We would have the proper apparatus in the clinical setting, but we're just going to use a stapler. So I'm just going to touch below the kneecap. Ready? That should go out. Obviously, it's going to be a little trickier. And now I'm going to check the biceps. Same thing. We're going to have the same thing going outside, and then tap, and it should. All right, same thing.
That one did it.
Which one?
Does it with my little finger.
Oh, really? Okay. So we did that, and now we're going to do the Babinski test with the feet. Now you can lay down, and we'll do the pencil or the thing. Scrape up, and the toe should curl, and there might be a tickle reaction with that. Now we're going to do the Romberg test for balance. Stand and close your eyes and make sure that there's a ball. Okay. And now we're going to do a normal gait walking. And then do toe to heel. Okay. And we're going to check the curvature of the spine. And then we're going to see that it's convex followed by concave, normal curvature of the spine. And can you bend over and touch your toes? You're going to see that it's midline, and it is, and that's the shoulders are midline, and the scapula and everything. Now we're going to do range of motion without moving your hips. Can you just turn to your right and then turn to your left? And we are done. Thank you. Well, is the butt.